Well, October is here. That means now is the time to start thinking about flu season.
And to help us prepare, we bring in our 9 health expert, Dr. Payal Kohli again. Good to see you.
Good morning, guys.
So we talk a lot about flu shots. Is there a best time to get a flu shot, or does it matter?
Today's the time, Gary. So what the CDC recommends is before the end of October. So Halloween is really sort of the hard stop when you should get it. Now remember, if you get a flu shot today, it takes 2 weeks for your body to build up the immunity, which is why it's a good idea to start scheduling them now, because we're just about a couple weeks out from the end of the month. For little kids, especially kids that haven't gotten a flu shot before, or they've only gotten one, they may actually need 2 flu shots in order to get adequate immunity, and those shots have to be separated by a month. So if you've got a little one, like my niece, she's 11 months old, so it's going to be her first flu season. So she actually needs to start a little bit earlier so that by the end of October, she's really hit both her shots and still has that full immunity.
What are the flu predictions for this year? Because I know every year they come out with what they think it's going to be. What is it looking like?
It's looking worse than the last couple of years because one, the masks are kind of gone. Second, we've looked at Australia and seen that they had an earlier flu season and a more aggressive flu season. And the third is, guys, our immune systems are a little out of shape when it comes to the flu because we had such low flu activity for the last couple of years. So this year, people may have more of kind of an extreme reaction to flu. We may have more circulation of the flu as well.
And speaking of COVID, we've asked you this before, but you can get the COVID booster and the flu shot at the same time, right?
Absolutely. In fact, now is the time to get upgraded on both of those because most of us are at least a couple months out from our last booster. And that's that new bivalent booster that has 2 strains of COVID. The flu shot this year is quadrivalent, so it has 4 different strains of the flu in it, both influenza A and influenza B coverage.
What are other things that people can do to prevent getting the flu?
So washing your hands, because it's the same thing. You touch the surfaces and you touch your face, and wearing those masks. So I am still wearing masks in the grocery store and indoor spaces because I haven't had a cold in over 2 years. And so it feels really good about that. But in general, just kind of being mindful to stay home if you're not feeling well, started to normalize many of those types of things that before we sort of are tough about it, power through and go to work when we're not feeling well.
Of course, trying to help prevent the flu is the whole idea, but there are other advantages to the flu shot too, right?
There's so many advantages, Gary. So if you're somebody who's high risk, the American Heart Association has actually published data that it can lower your risk of heart attack and lower your risk of cardiac arrest. It reduces the chance of you getting Alzheimer's. And the more you get it, the more it reduces the chance. If you have chronic lung disease, diabetes, hypertension, you're less likely to get in the hospital. And for seniors this year, I want to be sure that they know anyone over the age of 65 needs a special flu shot. It's a flu shot with an adjuvant, which kind of revs up the immune system a little bit more, or a higher dose flu shot because their immune system's not as strong. So the seniors this year need to be sure to ask for that special flu shot.
This might be a silly question, but is it the actual flu shot that helps people like prevent Alzheimer's, or is it the fact that you're not getting the flu?
A little bit of both.
Okay.
Great question. But if you get a flu shot, it actually protects you not just against the flu, but against other respiratory viruses because your immune system's a little better. So some of the theories of why we get heart disease or heart attacks or whatever is actually maybe an infection, maybe an activation of the immune system. So it kind of gets your immune system a little bit more in shape. But some people say that it's lingering stuff after the flu. So if you get the flu and then you have, lingering inflammation after, that could be what causes heart disease, Alzheimer's, those types of diseases.
All good information, and I got my old people's flu shot.
Good. I was going to ask you, not that you're 65 and above, but
Of course not. Yeah.
29,
All right.
always.
Dr. Kohli, good to see you. Thank you.
Thank you for coming in.